Hey, welcome back, everybody. Okay, so get these numbers. Last year, the Public Health Agency of Canada reported just 79 laboratory confirmed cases of the flu. Well, let's compare that to the year before that, which was at 50,000 confirmed cases in just one season alone.
Wow, what a difference. So, even though there was a drastic drop in flu cases in 2020, medical experts are predicting they're going to see those numbers jump this year. So, here with everything you need to know to protect yourself is our favorite doctor, Dr. Shelia Wijayasinghe.
Thank you. Nice to see you both.
Okay, I mean, I know we're still in the midst of this pandemic, so it's almost like, oh my gosh, we still have to worry about the flu. But yeah, we kind of do. And as we're starting to get closer to colder weather, I've got a couple of questions. What do we expect flu season to look like this year based on kind of what we've been experiencing? And when does it officially begin?
So, in Canada, we start our flu season in October and it runs till about April or May. It really depends on how the weather patterns go. And it looks like this year, similar to last year, we're hoping that it'll be a lighter flu season because of the public health measures. And as you mentioned, the numbers last year were drastically lower than what we usually see. And so, what we'd expect to see is based upon what we're seeing in the southern hemisphere, because they go through their winter months before our summer month, during our summer. And the numbers look low in Australia and in South America. But this being said, it's important to know that our travel restrictions are starting to lift, our public health restrictions are lifting, and as a result, we will see more flu cases here than likely what we're seeing down in the southern hemisphere. That being said, if we can keep on top of it, it's a really good idea. But I'm really cautious because we don't want to face a twindemic of sorts of COVID-19 and the flu at the same time, because that would be quite devastating for our healthcare system.
So there has been this huge uptick in health measures where we've got everything from mask wearing to hand sanitizing, and that obviously helps to keep the flu at bay. So is there anything else we should be doing to help protect ourselves and our loved ones from cold and flus this year?
So, absolutely. We learned so much last year on how we can minimize flu transmission with what you were just saying. So, all of those measures need to continue this year. And also looking at our basic lifestyle measures, right? Like keeping healthy, managing, helping our immune system be as strong as possible with good sleep, good diet, and rest and exercise. Those things are all really important. And also looking at how do we protect everyone around us with something like the flu shot as well.
Let's talk about the flu shot because, we're talking about a lot of needles these days, but the flu shot is one that we want to ask you about. Who exactly should be getting it and at what point as well?
So I recommend the flu shot to anyone over the age of 6 months of age, especially in a year that we're facing the COVID pandemic as well. So I recommend getting it for anyone over the age of 6 months, and also look at the reasons why we do that. So we do that for ourselves because we don't want to miss work. We don't want to be sick. When we do it, secondly, we do it for the people around us who are vulnerable to getting the flu that can't protect themselves in the same way. And third, we're doing it for our society. So this is our responsibility to everybody. When the hospital system is strained, we again can't manage a twindemic at this time. And so getting the flu shot is a really important piece of this, and I recommend it for everyone.
And we should be getting it as soon as they're available. Is that the idea?
Right. So they become available to us in mid to late October. And so they are available in your family doctor's offices, in your pharmacy, at flu shot clinics and public health clinics. And it's important to know that it takes about 2 weeks for the flu shot to become effective. So the earlier you get it in the season, the better it is to make sure that we can protect you for the entire flu season.
So I don't think I'm alone in this feeling right now, Dr. Sheila, that, if you start to get a little runny nose, a little tickle in your throat, maybe a little cough, and you just sort of freeze and panic because it's like, what is this? Is this a cold? Is this a flu? Is it COVID? How do we know the difference between all of the above? Because we're getting into the season where that's going to, all potentially be happening.
No, you're absolutely right. I feel the same way. I think many of our patients and everybody feels this. If you have any sort of tickle in your throat, you're going to wonder, is this COVID? And the truth is that the flu virus and the COVID-19 virus, they actually can have very similar symptoms. And the only way to differentiate between them is with a test. And so at this time, because COVID-19 is circulating so easily and it's easily transmissible in our communities, we always say we have to rule that out first. And so they share very common symptoms. So often you can some people don't have any symptoms, as you know, with COVID-19 or the flu, but the common symptoms between the two that they share are things like sore throat, fever, fatigue, shortness of breath, body aches and pains. And so those are shared between both of the viruses. And so really the only way that we can tell the difference is to get a test.
In line with all of the testing for people who are slowly coming back to work, into the office, how do you recommend that we navigate sick days this year? Because maybe in the past, I know I've probably been guilty of going to work when I'm sick and I know I have a cold.
You have.
Sorry, Cyn. We share an office, Dr. Shelia. I'm so sorry. I share everything with you, Cynthia. Everything. Love. But in all seriousness, I mean, that was the before time. So, like, what do we do now?
I mean, I think one of the benefits of the pandemic is that we've been able to see that we can work from home a little bit more than we thought before. So if you are having symptoms, I do think it's a good idea to stay home if it's possible. But this really highlights that that's a luxury for so many people, but so many other people do not have the luxury of paid sick days. And so if I may do a little plug for paid sick days, this is something that we all advocate for in healthcare, that we should be advocating for people to have anywhere from 5 to 10 paid sick days a year. So many people do not have the choice to stay home from work if they or their children get sick, and they have to go to work in order to feed their families. And so if we can advocate for paid sick days, advocate for that to happen, then people have the ability to stay home when they're sick and decrease the risk of spreading it. So absolutely, I think it's a good idea. If you can stay home, stay home. But we need to support those in our communities who can't stay home by advocating in that way.
Dr. Shelia, do we have any other viruses, out there that we need to be aware of as we get into the colder season?
Yeah, so, because school's back in session and we're congregating more and we're around more people, there are other viruses that the usual cold and flu viruses that we see circulating during the winter months, especially. In little kids, we worry about RSV, which is a common infection in newborns up to the age of 2 that can cause pneumonia and quite severe outcomes. So there are other viruses that are happening. And so what I want to emphasize in this situation, I think parents don't know where to go sometimes. And it's important to check in with your healthcare provider because we still need to see your kids. We need to treat them if there's something going on that's different. COVID isn't the only virus that's out there, and we remain here for you to see you and to protect you and to treat you if we need to. So don't hesitate to call us moving forward because there are other viruses that can cause these symptoms as well.
Thank you so much for this helpful and important information.
Thanks for having me. Stay safe.
Don't go anywhere. We'll be right back.